Medical Emergencies. This is Cardiac Arrest by Maria Celeste Garcia, and this course is FSO 310. Next, we have my first question is, what is cardiac arrest and what are their signs and symptoms? Cardiac arrest is a life-threatening medical emergency that occurs when the heart suddenly stops pumping like usual. As a consequence, the heart stops pumping blood to other essential organs. This condition can cause immediate death. Signs and symptoms of cardiac arrest are sudden collapse, abnormal breathing, unresponsiveness, and pale skin. The immediate first aid treatment is to ensure the airway is open. Check for breathing and blood circulation and begin CPR if a person is not breathing and has no pulse. An AED should be used as soon as possible. CPR procedures are different for adults, children, and infants, so it's important to follow the correct technique for each. Now, on the following, we have the in-flight first aid protocol and procedures that will have to be followed for cardiac arrest are the following. So if a passenger is to experience cardiac arrest while on board, I would first assess if the passenger is responsive and assess the scene for safety. If the passenger is unconscious and not breathing like they should, like normal, I would immediately request for flight crew to help assist in the medical emergency, and then instruct another crew member to bring AED, oxygen equipment, and the emergency medical kit, only if advised to do so by a doctor, or like by MedLink, I'm pretty sure it's called. Next, I would move the passenger individual to the most open space area possible. Begin CPR and apply the AED and follow the instructions they voice out, as well as keep the captain informed so that ground-based medical support can be contacted and a possible emergency landing can be considered. CPR and AED use would continue until the passenger recovers. Qualified medical personnel CPR and AED use will continue until the passenger recovers and qualified medical personnel take over or the aircraft lands. How to address cardiac arrest. Remain calm, act quickly, and follow the first aid training. My priority will be to assess the passenger's conditions and call for assistance after confirming cardiac arrest. I would begin to do CPR immediately and instruct other crew members to bring the AED and emergency equipment. I will provide clear instructions to nearby passengers, maintain communication with the flight deck, and keep checking continuously. By acting fast and following my first aid training and maximize the passenger's chance of survival until advanced medical care becomes available. What are the medical resources and equipment for cardiac arrest on board the aircraft, and how do they help to assist the passenger? Several medical resources are available on board to assist with the cardiac arrest emergency. For example, automatic external defibrillator, the AED, used to analyze the heart rhythm and deliver a shock if needed. The emergency medical kit, EMK, contains medical supplies and medications that may be used by qualified medical professionals. First aid kit contains gloves, bandages, masks, and other basic first aid supplies. Oxygen equipment provides supplemental oxygen when required. Protective equipment such as gloves and CPR masks to reduce the risk of infection. In a cardiac arrest situation, I will use the AED as soon as possible while continuing CPR. Oxygen equipment will be prepared if appropriate, and all actions will be carried out according to the flight attendant manual, FAM, and company procedures. The equipment helps maintain the passenger's condition and improve the chances of survival until emergency medical services can take over. Next are my credits, and then after just a thank you slide for listening, and thank you so much. I hope it's good. And this was it.